I'm Shan Sang-won Park, prosthetic urologist practicing in Seoul, South Korea. This series is about the penile implant. I am probably one of few who is hyper-specialized in the penile implant. My whole practice is focused on the penile implant. So I really haven't talked about the penile implant itself. Some of the patients ask me what I think about the penile implant or how, is there any information I can deliver to them. So per their request, I'm gonna give my opinion about the penile implant and how I see it. So what is a penile implant? It is a device placed on the penis that can restore the erectile function. Just like the dental implant, it has no change with any other functions like ejaculation, sensation, orgasm, or urination, or fertility, no changes. So whatever you were able to do before, or whatever function you had before, you will maintain that function. It won't get better, it won't get worse. The only difference is that the sexual desire seems to be increasing a little bit, probably because of the confidence issue. But what's interesting is that many patients said that the actual number of the having intercourse decreased. I asked them why, and they told me that because I was able to have a satisfactory intercourse, that kinda made them try it less than before. So before they had a good erection, they would keep trying because they were not satisfied. But as they were able to have a satisfying intercourse, they kind of stopped trying that much. Most cases I do the inflatable penile prosthesis because I believe it has a more natural, very close to the natural erection compared to the malleable. So 99 or somewhat percentage of my cases are inflatable penile prosthesis. Because I just give my patients two options. I show them the samples of the malleable and inflatable and let them decide what they want to go. And most of the patients chose the inflatable device in my country. Just like any other genital surgery, concealability or privacy, I believe, is the very important issue or aspect of this surgery. So probably this is a true thing, but more than 92.3% of my patients do not share this news or having the penile implant with their spouses or the significant other. Even so, most of the patient has no problem because women can really tell the differences with the natural erection when it's get fully erected. The shape of it or the rigidity and everything, most of the things are very almost the same. But there are certain partners who are able to tell the differences. So probably they have very keen eyes, but even experienced eyes, it's really hard to tell the differences. My philosophy about the genital surgery is that we have to make it as less noticeable as possible. So make it as close to the previous shape as possible so that the patient can have privacy kept intact. Compared to the other erectile dysfunction treatment, penile implant has a high satisfaction rate, probably because you know that you can have dependable erection anytime you want. Pills, when they work well, it has the same responses, but in certain cases, sometimes it works and sometimes it doesn't. So that's what makes men really uncomfortable. Penile implants are nothing like that. Whenever you demand, ask, we can show you a dependable erection. Probably that is the reason why it has a high satisfaction rate. Thanks to this method, virtually all men who has an intact penile anatomy can have their erectile function back. This is the really short story about the inflatable penile prosthesis. In next coming series, I'm going to talk more about other aspects of penile implant.